You're listening to episode 127, Courtney's story, a daughter born at 25 weeks. Hey friends, it's Katie from Child Life On Call. For the month of July, we are reposting some of our most downloaded episodes from the past 5 years. First up is Courtney's story, which is the most downloaded episode in Child Life On Call history. This story was originally published in 2018, and she shares her story of her daughter's birth at 25 weeks. To give you a little update, McKenzie, her daughter, is now a thriving 7-year-old, and her mom, Courtney, is just killing the mom career, fashionista, model, sneaker designer, fit chick, boss babe life. She is incredible. Go follow Courtney on Instagram at sunny.com, and here is our conversation. Before we jump into the episode, I wanted to let you guys know that if you are a parent, a child life specialist, or professional working with children, you're going to want the hospital or physician's office or urgent care that you take your kids to have the Child Life On Call app. It is an evidence-based tool designed to empower children and families during medical experiences. And 100% of the child life specialists who have used this app believe that it can help with expanding child life's reach beyond the bedside. And 100% of child life specialists believe it helps parents feel more empowered in their child's care. Learn how to get the Child Life On Call app for your facility or doctor's office by going to childlifeoncall.com/partners. At around 16 weeks pregnant, Courtney learned that McKenzie was measuring small. Although not incredibly concerning, they asked Courtney to stop exercising. Appointments had been normal after that until she was seen at 25 weeks.
The nurse checked my blood pressure, and I could tell by the look on her face that something was wrong. And I asked her, I was like, is everything okay? And she was like, yeah, everything's fine. Just lay on your side. I'll be back in about 10 minutes. And so I was like, this never happens, like, during my appointments. I'm usually in and out. And then she comes back, and she takes it again. And she was like, just continue laying on your side, and I'll be back. It was time she brought the doctor in. And they took it, my blood pressure the third time. And then she told me that they were going to have to admit me into labor and delivery because my blood pressure was really high. And at that point, I start freaking out. I'm bawling my eyes out. Sorry. The nurse rolls me from the doctor's office into the hospital part, and the first thing I did was I asked her to pray with me because I couldn't get any words out. And they put me in labor and delivery room and hooked me up to all these machines to monitor her, monitor myself. Started pumping me full of blood pressure medicine and magnesium to keep me from having a seizure. But they never let me see what my blood pressure was. And the doctor came in and gave me a steroid shot and told me what it was for, that it was for the baby's lungs to help her. And I just keep asking, like, please don't make me have my baby right now. Like, she won't make it. Like, I can't live with losing my child. She was like, I can't promise you that.
After an incredibly emotional and scary time, Courtney learned that she was unable to stay at that hospital because their NICU was not well equipped for a preemie that young. Courtney was then transported to Medical City, Dallas.
I'm like riding in this bumpy ambulance and my blood pressure is sky high. Of course, I don't know, like, because I was asymptomatic. I didn't have any symptoms. There was no headache. There was no chest pain. There was no short of breath. I felt fine. I couldn't understand why they were keeping me. And I get there and I'm in labor and delivery room, and the first night, I'd actually asked my best friend, like, hey, can you come and get my car keys and move my car and take it to my apartment because it's at the other hospital? And can you walk my dog? Like, I'm laying in bed going through all this stuff. Can you walk my dog and make sure he's ate and keep my keys in case you have to go back? And can you bring my work computer? Like, of all things. And all of my friends call me Sunny. That was my name in the entertainment world. I did radio for 4 years, and so I've always called me Sunny. And so he comes to the hospital and lets me know that all that's done. He brings me my work computer, and by that time, a NICU doctor comes in, who happened to be one of my favorites. His name was Dr. Slenderman. He was a straight shooter, and I liked that about him. I didn't need anybody to sugarcoat anything for me or to make my situation easier to digest. Like, it's hard enough. Like, I really need the truth. I don't care if it's ugly. Like, can you tell me? Because, of course, he started his usual courtesy stuff, and I was like, look, I don't need that. I need you to tell me what's going on with me, what's going on with my kid, what are her chances. Like, I need to know everything. And he was like, you want to know? And I was like, yes. And he asked if I had seen my blood pressure, and I was like, no. And we are talking like 240s, 250s over like 120. Like, it was out. Like, looking at those numbers terrified me because I know I am in stroke and heart attack range and I feel fine, which brought about another uncomfortable reality of what if it happened when I was home by myself? Because I was in the pregnancy by myself. He let me know that, and let me know that with the test, I had severe pre-eclampsia. It's in like stages of like 1, 2, and 3. I was 3. Most women develop it in their third trimester, closer to their delivery time. I developed it early. Nothing I did, to bring that on. And then asked, had I received a steroid shot? And I was like, well, I got one before I got here. And he was like, well, if you're still pregnant tomorrow, we'll give you another one. And I was like, okay. And then he let me know, that her chances were like 20 to 30% of making it. He was like, she does have a few things working in her favor. 1, she's a female, and 2, she's an African American female, which I didn't know, that they have the highest chance of all preemies of making it. And that they were going to try to keep me pregnant as long as they could because that would help the baby, but that they would deliver at any time that my life or the baby's life was in danger. He also told me I wouldn't be able to deliver her, have a normal birth, because of everything that was going on, that she wouldn't survive normal childbirth. So I would have to do a C-section. And I appreciated his honesty, really. It was, I needed it. I didn't want to try to read between the lines or try to figure out what they were saying. Then I was being poked and prodded all the time, all day. And I asked one of the nurses, what is it that you're looking for? Because, of course, they're monitoring the baby as well. And she's like, well, we're looking for signs of distress on the baby. Or she's like, what is called HELLP syndrome? And I asked her, well, I mean, I don't know what that is, you know. Like you're talking to the lady here who my only surgery has been my wisdom teeth. Like that's it. I haven't had anything else. I've never been hospitalized for anything. I've never spent the night in the hospital. Like I've been like perfect health, like just wisdom teeth, you know. And she lets me know that basically it's a breakdown of your red blood cells, a low platelet count, and it affects like your liver function. It can affect your organs. I was like, okay. And she was like, but everything is showing up fine right now. And at that point, my parents had come down. My father had gotten off work, picked up my mom, and drove straight from West Virginia to Dallas. I could tell, even when I saw them, like they were scared. I mean, you can just tell by the look in their eyes. They can't fix it. Like they can't fix me. You know, I'm their baby and I'm worried about my baby. She comes in and she's like, we're going to have to rush you down to labor and delivery. I was like, what? I was like, no. She goes, yes. So then I start crying because I am absolutely terrified at this point because I only lasted 5 days. From the time I got hospitalized to the time I had my C-section, it was only 5 days. I'm like, well, can I take a shower? And she's like, Miss Hughes. I was like, look, ma'am, I have had to take a whole bath the last 5 days I've been in here. I've been hooked up to a catheter. Y'all won't let me get up. You won't let me do anything. And now you're telling me that I have to go down here to surgery so you guys can deliver my child because something's wrong. And she goes, well, you've developed HELLP and your organs are shutting down. Okay, can I take a shower? 2 minutes, please. It's like if I won't go, like I want to be clean. Like can I just take a shower? And I'm crying, and she's like, 2 minutes. I'm gonna be at the door. I was like, and she honestly not the door like the bathroom, but like the door to my room. She stood there the whole time I took a shower, and I got out, and she's like, do you feel better? I was like, yeah, a little bit. And so I called my parents and I call his mom and call him and, you know, let them know that they were taking me down and I'm in there and they were like, you know, who would you like in the room? And I'm like, my dad. I'm a daddy's girl. And then they come back and they're like, okay, we can't have anybody in the room now. And I'm like, why? And they're like, well, due to the HELLP syndrome, you could possibly bleed out if we gave you an epidural. So we're going to have to put you all the way under so nobody can be in there. And when the doctor was like, you know, I need you to sign these forms and if you would like us to resuscitate you. And life just like flashed, like kind of like, is this really happening to me right now? And if I would allow them to do a blood transfusion, if they needed to do one. And then when he asked me, do you have your affairs in order? I was just like, you have got to be kidding. Honestly thinking that I wasn't going to wake up. And at the time, I, you know, just like, my God, if you're going to take us, just take both of us, please. Like, I don't want my child to live without her mom. I don't want to live without my child, which is probably very selfish at the same time, too, now that I think about it. And I went in and I woke up in a room because I'm allergic to acetaminophen. So there's not much pain medicine that they could give me anyway. So I had like a little morphine drip, and it's not like they could give me anything else. So I didn't get to see her until a day after I had her the next day. You know, I'm thinking like I'm only 28, you know, not to be 29. Like, how is this happening to me right now? You know, like we think we have so much time Like we take advantage of the time we have as if we have more of it because of our age, when in reality, you honestly just don't know. And to be like thrown into that suddenly, the scariest I've ever been through. But man, I'll tell you, nothing could have prepared me to see my daughter the way she was.
Yeah, what was that like when you finally got to see her?
An overwhelming feeling of love and happiness and sadness. I was scared out of my mind. I mean, she was only a pound and 4 ounces, 12 inches long. I mean, she was small. I cried for the whole time she was in there. You know, either before I got there, I'd have, you know, crying spell in the car, or after I left, I'd sit in the car in the hospital parking lot and I would cry for a while, and pray and, you know, just ask for strength, because I'm like, I can't do this by myself, you know. And I knew for certain that I was never going to let her go through this by herself either. It was one of the saddest things, honestly, to see in the NICU. I mean, I know there are parents who can't due to job obligations, and, you know, they choppered patients in all the time, and so their families live far away. But for people who live there, and I mean, they just, as the nurses would tell me, I was the exception to the rule of parents, because every day for 5 months I was there from 7 in the morning until 8 at night. I was at the hospital in her room. It's like a pod. You have a chair. They have like pumping stuff for you, and touch time is every 3 hours. And but it's like and then I felt like my parents looking at me is the same way I felt looking at my child. Like, I can't fix you. I can't make it go away. I can't make it better. But I can be here with you the whole time.
Courtney was very fortunate that her job at Dell never made her choose between her life as a mom and her life as a career woman. She was able to work from her laptop and join in on conference calls, all while she was next to her daughter's bedside, being able to talk to doctors, talk to nurses, and stay up to date with her daughter's care.
I felt like a student again, because I didn't know anything about it. So it was putting myself in that position to understand exactly what's going on with her, and what does this mean, and what does that mean, and what is the process going forward? How do we correct this, if it can be corrected, or is it a wait and see type of game? And I bought books, all kinds of books. I read when I got home, and I would read on the weekends to understand, because it's like for me, I felt like I couldn't advocate, be a big advocate for my child if I did not understand what was going on with her. I couldn't make the best decisions for her if I did not know what X was. And the only way I knew how to do that was to dive in and to try to understand.
I've had a lot of parents say that they feel like they go to medical school when their child is in the hospital, because they just learn as much as possible, are constantly studying exactly what you said, just wanting to know every little thing so they can make good decisions.
Yes. You feel like you're a mom, you're a doctor, you're a therapist, you're a nurse. I mean, you feel like you're everything.
Courtney's hospital let her choose a primary nurse if she happened to come across a person that she really connected with. Staying true to herself, Courtney did not choose the nurse who went the easiest on her.
When listening to this next story, it's important that you know that some mothers of NICU babies need to take medication to keep up a milk supply and also keep a rigorous pumping schedule.
I come in one morning and I had skipped a pumping session. She goes, "Mom, Hughes?" And I was like, "Yes." She's like, "You're missing one." And I was like, "I know." I was like, "I just needed a little bit of sleep. Like, there's just so much going on." And she goes, "Oh, so if your baby was home, you're going to miss her feeding because you have so much going on." And in my mind, I was like, "Oh my gosh, I like her." You know, I'm very direct, straightforward type of person, and all of my friends are that way too. Like my really close friends are that way. And we hold each other accountable. And here this woman was holding me accountable because I skipped the pumping session because I was tired. I was just like, kind of like smacked my lips and was like, whatever. And sat down and then, touch time, because their central nervous system isn't fully developed. You can't touch them and rub them like you do normal babies. And so, because it overstimulates them and it hurts because their central nervous system isn't developed. So that's why they do it like every 3 hours, minimize touching and rubbing. And we were doing her touch time, and she was like, "Do you have the diaper?" I was like, "Yes." And so we did the diaper, and she was like, "Would you like to take the temperature instead of me taking it?" I was like, "Yeah, I would love to do it. Can you watch and make sure and guide me so that I'm doing it right?" And so we did that, and I told her what it was, and she wrote it down, and she was like, "Well, if you feel comfortable, you can do the touch time, changing her diaper, let me know if it's wet, dry, or bowel movement, and doing her temperature, and just let me know the numbers, and I'll write it down." And I just asked her, like, I started asking her questions about McKenzie and, what are things that they're looking out for when they do certain tests. And she was very patient with me and really explained things to me. And she honestly didn't mind my 50 million questions that I had every day, all the time. And I asked her, like, "Would you be our primary nurse?" And she was like, "I would love to." And she is like one of my best friends now.
Next, Courtney walks us through the emotional toll that having a child in the NICU can really take on someone.
The NICU it's a lifesaver, but God, it is a horrible place. You see these innocent children in such horrible conditions. It just breaks your heart. And there's nothing any of us can do. I mean, it's like you're a spectator in what's going on with your kid. I mean, you don't know. I mean, there were plenty of times where, McKenzie would be doing better for a few days, and then she'd take a dip down for a few days. I mean, the constant roller coaster of up and down. I mean, what that does to your emotions. I remember specifically one time, as a matter of fact, it was a few days after I'd had her. I was still in the hospital because, unfortunately, my pre-eclampsia didn't go away with delivery. And so they were trying to find the right mix of medicine to control my blood pressure to send me home safely. They were worried about me having, seizures or a stroke or an aneurysm, which can happen. And so I was in the hospital for another 2 weeks after I had her. I didn't even get to go home right away. And my dad rolled me down one day, got pumped, and I was like, I want to spend some time downstairs with the baby, because I was on the 6th floor and she was on the 4th. And we come in, and the lady at the front, her name was Miss Barbara. You have to scrub in from like the elbow down. And I'd seen this white flower on the door, and I didn't know. but I'm a very inquisitive person, so I ask questions. And I just happened to ask her, I'm like, hey, I see the white flower. Is everything okay? And she goes, we use a white flower to signify that, baby is passed. Man, it's like a punch in the gut, just, to know that some family lost their baby. And I'm sure every family in there, including myself, you're praying that one day that flower isn't your kid,
Because of McKenzie's lung issues and immature immune system, Courtney's doctor encouraged her to minimize visitors to just McKenzie's mom and dad.
Doing whatever I had to do to protect her and to give her the best chance of possibly making it out, even if it meant me being the bad guy for other people. And that's a lesson I learned early that still carries on to this day. There have been plenty of people who haven't agreed with what I've done. My own mother, for example, was not very happy when I made the decision to give her feeding tube. I mean, cold and flu season, the doctors are like, I don't need to go anywhere. And I was like, cool, we're not going anywhere. We'll go to the doctor and we'll come home. But of course, I had to screen people that were coming over. Like, have you been sick? Are you sniffling? Are you coughing? Like, have you been around anybody that's sick? Have you gotten your shot? And if any of those answers were like, no, I haven't gotten my shot, or yes, I've been sick, I'm like, we gonna have to holler at you later. You can't come over. But that, in the NICU, it taught me early that not everybody is going to agree. But at the end of the day, I'm her mom, and I know her better than anybody else. The doctors ask me now, and have been, what do you think? You know her. How do you feel? What are you thinking? We are all a team, and we are on Team McKenzie. And we all have to work together to get her to where she needs to be.
We'll be right back.
If you have ever wondered where you could get those cloth dolls that Child Life Specialists use with kids for medical education or sending home to siblings or to draw on for therapeutic activities, then you don't have to wonder any longer, because our friends at Smile Makers have decided to now sell these amazing cloth dolls for a very affordable price. I know that when I was in the hospital, I would have to rely on a volunteer network to then give us the dolls, which was really nice, but I had to wait a lot of times. Like, I would need a doll now and I wasn't able to get it. So this is a great place to be able to go get your procedure dolls at smilemakers.com. And y'all, they have 3 different skin tones for these cloth procedure dolls. In addition, you can actually buy a procedure doll prep bundle that comes with fabric markers. This is a fabulous way to do your medical teaching, to help siblings feel involved, to get kids creative, to do a lot of teaching about different diagnoses. And so go to smilemakers.com so you can get your cloth dolls as soon as possible before they run out. And when you go to that checkout to get your cloth dolls, also type in OnCall20 and you will get 20% off your entire order. So not just the cloth dolls. So if you get a bundle for Child Life Specialists, if you get a piece of furniture, if you get one of their really cool toys and prizes, or you order a large sticker order from them, OnCall20 gets you 20% off your whole order. That's smilemakers.com, code OnCall20 to get 20% off.
Before being discharged home, the hospital implements a stay-in, where the parent or parents are required to live in the hospital day and night for up to 4 to 5 days. They have to perform all the tasks that will need to be done at home, and all of this is being observed by a nurse.
Sometimes you think, oh, we're going to go home and everything's going to be great. And it's like, no. They feed every 2 to 3 hours. Kenzie fed every 2 to 3, and we had breathing treatments every 4 hours. She Came home on oxygen. She was on like 0.2 liters of oxygen that she had to be hooked up to 24 hours a day. She had a pulse ox that measured her oxygen throughout her body that she had to be hooked up to at night, and you had to do checks during the day. And then you keep all your doctor's appointments. So all of the specialists that she was seeing in the NICU, well, now she sees outside of the NICU. And I swear for like the first year, man, we were at the doctor's office like 3 to 4 times a week, every single week. Nothing can prepare you for that. You know, you so wish and long to have this normal, quote unquote normal, at home experience with your child. And sometimes you kind of feel like that you and your child have been robbed of those things because life happens. You think about it. So you have a feeding every 2 to 3 hours, and you have a breathing treatment every 4. So every second feeding, you have a breathing treatment before that feeding. And because that breathing treatment lasts like 20, 30 minutes, and your feeding before that at 2, for example, lasts 30 minutes, that's like 2:30. So that means I have to start her breathing treatment at 3:30 in order to do her feeding at 4. That's like 45 minutes of sleep, if even that. If you can even sleep. You know, like you're on edge. You know, are they breathing? Is everything okay? And God forbid they are moving and the pulse ox comes off in the middle of the night. I had so many meltdowns, just crying, like, I don't know if I can do this. Like, I don't know if I could do this. And then I look at my child, and it's like I have no other choice but to do it. I don't. Because if I don't do it, where does that leave you? If I don't pull it together, how am I helping you? In the NICU as well, they start like feeding. Usually they're fed through an NG tube in their nose. And because McKenzie was on the breathing machine for longer than the time they like you to be, she developed an aversion in her mouth. So I forgot the week number that they like them to be off of it and onto like a cannula, because they can sense that something is down there and it's not supposed to be down there. And for them, it's traumatic for them. You know, they can't swallow, you know, they can't close their mouth, and you have they're suctioning fluid, like phlegm, basically fluid and stuff all the time, and it's not pleasant for them. And so when it came time to try to work on like feeding, she had a really, really hard time because she didn't like anything in her mouth. And she ate better for me than she did the nurses. So they were like, can you make sure you're here for feeding time? And, you know, we worked so hard on it too. And we got home, and after 4 days, she was eating like a champ, and I was happy about that, stressful about the other stuff. And then I started to see the signs of regression, started to see the things I saw in the NICU with her eating. And I knew we were going nowhere good. It was like, I'm going to call your doctor. She gave, you know, us some medicine. She had GERD really, really bad. Oh, my God, like after every feeding, too. I mean, that's like 8 times a day. And, I mean, feed her slower, you know, also had to thicken her milk. And so at this point, she was on nectar. Anything thinner than like the consistency of nectar, she would aspirate into her lungs. And you have people that are just like, oh, just feed the baby, she'll eat. and you just want to punch him in the face because it's like, it's not that simple. Like, for you, it was that simple. But for my child, it's not that easy. And the oral aversion and the GERD were so bad, I would have to dream feed her. And then it got to a point where that wouldn't work anymore either. So she went from taking like 16 to 18 ounces a day to taking 4 to 6. And she was as happy as she wanted to be when she wasn't having to eat. And it's like, you haven't ate anything today. Like, how are you okay? You know? And so the GI doctor, you know, prescribed some medicine, and that didn't help. And we did an endoscopy, a scope of her throat and stomach and small intestines, and everything looked fine. And so we did an NG tube down her nose. And I was just like, I can't do this. Here, like, there it was again. I can't do this. I was like, what if she pulls it out? I don't know how to put it back in. Like, you know, I'm such a horrible mom. I don't even know how to put it back in. You know, this is like necessary for my kid. And one day she actually pulled it out, and I started freaking out. And I called Stephanie. And I was like, hey. And she goes, what's wrong? I was like, are you working today? No. And she lived in Plano, and I was in Irving, and that was maybe like a 35-minute drive. And I told her, I was like, Kenzie pulled out her NG tube, and I don't know how to put it back in. Like, she goes, not a problem, I'm on my way. And she drove 35 minutes for something that she did in like 5 seconds. But she taught me how to do it and brought me a stethoscope so that I could listen for when I had to do a pull to make sure that it was in the right place, because you can, you know, it goes up through your nose and down the back of your throat and into your stomach. But if it's not done correctly, when you're pumping milk into them, if it's not in the right place, then it's going into their lungs. And McKenzie was so active, man. She would hook that thing with her finger and pull it right out. Sometimes during a feeding, she would pull it out. I mean, this child was always pulling that tube out. And like, that was her way of telling me, like, Mom, I need more time. As a parent, it's hard. Like, you know, I'm fighting to give her the time to, we'll get it together. We're going to work on it. We're going to work on your feeding. And you and me, we're going to get it together. We're going to get this thing rolling. And, you know, we'll have some bumps, but we'll eventually get there, and we won't need the nose tube anymore. But she was telling me, like, I'm not ready. I need more time. And, you know, ultimately made the decision to get her a feeding tube, which wasn't easy. You kind of feel like you're giving up on your kid, but at the same time, you're giving them what they need. It was a complicated feeling to have, like, I feel like a failure, but I know I'm helping her, if that makes any sense. It really doesn't, you know, because the feeding with your kid is natural. You know, your child taking a bottle, I mean, those are just natural things. And you might stumble a little bit with breastfeeding, or, you know, trying to transition from nipple to breast to nipple, whatever, but just the feeding is just natural, whichever way you do it. And stick to it. Now, the transitioning part, that's a whole other thing. But whichever way you decide to go, I mean, once you get the hang of it, I mean, you're golden. And it just wasn't like that for her or myself. And you feel like a failure as a mom. I did for a little bit, because it's like, I can't even feed my kid. Like, you know, to plug her up to a pump that pumps milk in her stomach, and it was like charging your phone. It was the most disgusting feeling for the longest time for me to have like a machine like pumping food into her belly, because, you know, it took some time. She still has her tube, but now looking at it, it helped us because she needed the time, and she still needs the time. I hate it. I'm looking forward to the day that there's no more tube feeding, and I mean, you have equipment coming every month and milk coming every month, and I look forward to the day that, you know, we don't need it, and she eats like a normal kid. You know, we've worked really, really hard at it, and I, with the help of her feeding therapist, her name is Jenny McLaughlin, and she's like the absolute best. You know, we've been able to make major progress, but then, you know, it opens up your eyes to a lot of other different things, because, you know, you come to the realization of working for me that, okay, you know, not only do we have lung issues from being born early, we have feeding issues because of the tube, but that's the root cause of other things. And she has sensory issues in her mouth. Those, I mean, I knew she was aversive, but when you kind of learn to put a term to those and what those are and how it affects the eating, you begin to understand more of what your child is going through. And so it's still hard, but it's it makes it easier to manage and easier to be understanding because you understand. And it's not just, well, we just messed up. You know, maybe I did something wrong, you know.
I think we've talked about some of the hardest parts about this, and you kind of talked about communicating with family and just having everybody kind of understand where you're coming from. Now that she's 2, has that changed at all? Or what is it like kind of integrating the things that she needs with your everyday life?
It took a while, because I guess for me, it was not how can I fit her into my life, but how can I fit my life into hers. I mean, because how I was raised, you know, when you have kids, like your life is not yours anymore. And so it was not about modifying her life to fit me so I'm good. It was about modifying my life so that she's always comfortable, even if that meant having cabin fever during cold and flu season, because we couldn't go anywhere. We couldn't go anywhere but to doctor's office, therapy, and home. You know, I had some friends, they would go to grocery stores, like, hey, we're going to a grocery store. I'm like, okay, can you pick up such and such? I consider them my family. One of my coworkers, his name is Chip, and his wife, Miss Diane, they're my family. They were the easiest, because during the time at the NICU, every Sunday for lunch after church, they would come by the hospital, pick me up, take me to go eat for lunch, and then drop me back off. And they would always bring like a basket of goodies. Like she was always baking brownies and baking cookies, or she'd bring me like a basket full of snacks, or a devotional for me to read. And, you know, they were an absolute godsend for me. And when we came home, Miss Diane would come over every week, and she would spend all day with us. There were some people, though, that it was harder for them to kind of to understand the fact that I know this may have been how you were used to doing it with kids before, your own kids, your own other grandkids, your cousins, whatever. But things are different for McKenzie, and things have to be done this way for her. And so it was a struggle for some to realize that things have to be done differently. Like things are not okay. So, now, we go to the grocery store. Probably about like any typical parent with a toddler at the grocery store. You don't want to do it. So I will curbside in a heartbeat. But there's still modifications that have to be made. She's tube fed 3 times a day, now, after breakfast, lunch, and dinner, the daycare. Moving here from Dallas, I had the hardest time finding childcare because nobody would take her with her tube. I'm sure it's just a liability. I'm just like, oh my God, am I about to lose my job? I was laid off. And for a month was in like complete turmoil because I have a solely medically dependent child and I don't have a job right now. So then when I got the job I have, and then I was having a hard time with daycare, I was like, man, am I about to lose my job? Like, I can't lose my job. But they were so great. It's like, look, if you're not able to, you can just come down, every 2 to 3 weeks for a few days. We can do that. We can work with you. But then I'm thinking in the back of my head too, like, well, who am I going to leave her with for 2 to 3 days? Because it's been just me. So then the place that we're at, they were hesitant. I had to fill out, a questionnaire. Her doctors had to fill out a questionnaire. And then they accepted her on the sole condition that they did not touch her tube. So I have to leave work every day to go do a tube feeding. If she has medication in any time in between that time, I have to leave work to go administer the medicine. I have to leave work if she has to have breathing treatments, if her allergies are acting up or whatever. I'm constantly I'm having to leave to go do something. And again, I'm very blessed and fortunate that, nobody's hounding me about having to go give my kid medicine or go give her tube feeding during work hours. But it's been a constant, rearranging of my life to make sure that she doesn't feel a hiccup or a bump or anything. And I think that's how it should be. Honestly, she shouldn't have to suffer because I'm uncomfortable. And she shouldn't have to do without because I'm uncomfortable. And I got to sacrifice this and I have to give up that. I would honestly give up everything I have for everything just to be normal.
What helps you cope with everything that you have going on?
Prayer. Just my experience with her definitely shook me to the core of who I am. It did. Me and God had a lot of conversations. I wasn't happy. I was upset with him. Like I mentioned earlier, my mom is a minister. Our grandfather was an elder. My aunts and uncles are preachers. One uncle is an apostle. I grew up in a family that knew God and we know how to pray. And I was mad at him. Why? Why? Why me? Why her? I treat everybody right. Why? Why do I have to be the one to go through it? Why can't things just be, unicorns and rainbows over here, man? My faith, praying, I did have to go see a therapist. I actually haven't talked openly about that. I don't mind sharing. In the African American community, I'm laughing because it sounds so bad. You tell them something's wrong, man, you better go talk to Jesus. Take it to the Lord. And you're just like, you know what? Look, God gave us doctors for a reason. He also gave us therapists for a reason too. Yeah. Man, my mom, when coming up on her first birthday. And she was off of her oxygen, so, no pulse ox, no oxygen machine. And I started hearing, like, beeps all the time, like hospital beeps. But, man, the sound that damn thing, like, I still have bad dreams about, and I can hear it. I would hear it when I was asleep. I would hear it when I was awake. And I was talking to my friend Ebony about it. And the first thing she said to me was, you have got to call your employee assistance program tomorrow and find a therapist. She's like, I've been telling you I think you're depressed, and you keep saying no. You think it's the baby blues, and I keep telling you no. And she was like, in this? And she was like, no, I'm not doing this anymore. You have to go find one. And so the therapist in the NICU, I had asked her, and she referred me to a lady, and come on out, I was suffering from postpartum depression and PTSD. Therapy helped a lot, a whole lot. I had to have difficult conversations with friends who I'm not as close with anymore, kind of feeling like abandoned in a sense, like you kind of just disappeared in like my worst time. Talks with family members about, and that's the thing, they all mean well, about being dismissive of what's going on. I got a lot of, oh, it'll be okay. Oh, everything will be all right. Not like actually listening to me. Like you're dismissing everything I'm telling you to be like, oh, it'll be okay. Like, I'm not asking you if it's going to be okay. Like, I just need you to be there for me and to listen to me. Because at the end of the day, nobody else is going through it but me anyway. Like, you're on the outside looking in, and I need somebody to talk to. I don't need you to tell me it's going to be okay. I don't need you to encourage me. I guess maybe for me, you kind of got to a point where it's like, I know I'm going to be stuck in this thing for a while. Like, we are going to be in the thick of this thing for a cool minute, and I just need somebody to talk to. I don't know how it's going to play out. I don't know how it's going to end. I don't know a timetable of when she's going to come off, when this is going to go away, when I don't have to do this anymore. But what I do know is that I'm going to be in it for a while, and I just need you just to listen.
Well, that's amazing that your friend Ebony helps you get there, and that your therapist could take you from there and figure that out.
Going through it wasn't fun. I mean, no, working through the emotions and feelings and a lot of anger at different people, it wasn't easy. And so one thing she did encourage me to do was to have conversations, and then once we got further along in therapy, was like to start writing again. And so I relaunched my blog, funnyd.com, and I'm not as consistent as I should be because clearly life gets in the way, but I talk about different things with us, like feeding and, different struggles and stuff that I have. Sometimes I feel like it's easier to do it in writing than it is to talk about, because I can cry and type, and there's nobody there. Nobody can hear me. Nobody can see me, and the tears can just flow. And sometimes, you're kind of scared of people judging you for where you are, or maybe the emotional state that you're in, or the mental space that you're in, going through this, when in reality they just don't understand, so they don't know any better, because it's easy to say, well, I would do this, and it's like, cool, trade me places for a day. I haven't built my village here yet. I've only been here 2.5 months, but I had a nice small village in Dallas. When we go up there sometimes, we have stuff to do, because I actually took on a second job to help me pay for medical bills. Somebody in that close circle will watch her and they've been around, they've spent the time, they know how to take care of her, and I don't have to. And I think it's a trust thing too. I know that they will do whatever needs to be done for her. Having that helps.
At the end of our interview, Courtney eloquently expresses the selflessness, love, and drive that she practices on a daily basis.
You always want to do what is best for your child, even if it's something that you don't want to do, that you would prefer not to do. I mean, if it's in the best interest of your child, then you just do it. Your feelings do not matter. That's one thing I have learned as well. My feelings about, I don't like going to therapy. I don't. We're in speech therapy twice a week. So after a tube feeding, I go back to work and then leave work to within an hour to pick her up, take her to therapy where she's at for an hour, and then come home. So I'm working in the front office of the therapy session, sometimes taking conference calls from my car. I don't want to do that. But my feelings do not matter because that is what she needs. So, like it or not, you just suck it up and you give your child your absolute best. That's my thing, is to give her my best and to be there with her every single step of the way. She is never going to think that she is in this thing by herself, because I'm in it with her. And it's just that selfless love that, when I look at her, I think about that day that I was in the hospital, telling the doctor, I don't care what happens to me. I just need to give her the best chance to live. Laying your life down on the line for your kids. And that's something, with a kid with special needs in any way, or, learning disabilities and speech delays. McKenzie has a speech delay. Found out today about apraxia with her. It's a constant laying down your life on the daily. And I just hope one day when she gets older, she realizes everything that mom had to do. She's very thankful.
I am so incredibly grateful to you, Courtney, for sharing your story and being so vulnerable and expressing your words and your feelings. There is no doubt that you are so strong, and McKenzie is lucky to have you as her mama.
Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/childlifeoncall, and you can listen to more episodes and find resources at childlifepodcast.com.